Good afternoon. My name is Brian Grzymkowski. I'm one of the Assistant Directors of Graduate Admissions here at William Paterson University. Want to thank all of you for taking time out of your schedule to join us this afternoon for our webinar about our MA in Clinical and Counseling Psychology. I'm joined here by Dr. Winnie Ma, who is the Program Director and is going to speak in just a couple minutes about the program and go over a lot of the specifics that we hope you'll find helpful. Certainly with this type of a format, it's our hope that this is a very convenient and easy way to get a lot of very helpful information about the program in a relatively quick span of time. And whether you're enjoying this from the comfort of your couch, whether you're at the office on a lunch break, or whatever the case may be, we hope that this is convenient for you. Can't stress enough, though, there's no substitute for the opportunity to come on campus, see our facilities and the campus for yourself if you haven't been here. So also want to stress, just so you're aware, as sort of a save the date, on February 26th, a month from today, we're going to be having our next graduate admissions open house, and I know there are going to be representatives from the Clinical and Counseling Psychology program there. So certainly if you're interested, if you enjoy what you hear today, that's a great opportunity to follow up, to meet some of the faculty that you might be working with in the program, to talk about the application process further. So certainly keep that in mind. That is a Sunday, and that is going to be taking place from 1 to 3 p.m. So again, just to save the date, looking about a month out, certainly we hope that you're able to join us for that. The only other thing I'll touch upon real quick is sort of a housekeeping issue. I want to make sure you know we want you to be able to be hands-free while you go through this presentation, not jotting notes, typing anything as you go through. We want you to know that we are going to make this presentation available for download under the handout section on the GoToWebinar screen. And also, we are going to be emailing everyone a recording of this presentation, usually within about a week of when things wrap up. So whether you join us a little bit late, if you have to leave early and you might miss a couple slides, we are going to make sure that you can refer back to this and watch anything you might have missed. Or if there's contact information, specific program details that you might find helpful, we want to make sure you can refer back to that a little bit further down the line. So with that being said, I know you're not here to listen to me talk. You're here to listen to Dr. Ma talk, so I will turn it over to her. So Winnie, if you're ready, take it away.
All right, thank you, Brian. Hi, I'm Dr. Winnie Ma. I am the Program Director for our Master's Program in Clinical and Counseling Psychology here at William Paterson University. So I want to start out kind of just to tell you a little bit about William Paterson University. And in case some of you are not familiar with us, we are a mid-sized state university located in northern New Jersey. And we are located in suburban Wayne, New Jersey, and just 20 miles away from New York City, so there's relatively easy access going to New York City and some of the surrounding facilities. And the sort of beauty about being here at William Paterson University is that we have a beautiful campus, and also we emphasize on small classroom size. So definitely there is the advantage of having the personal attention and also the extensive opportunities located near our university and also in the surrounding communities. So a little bit more about our program and why I think our program could be also appealing for many of you. We are a master's program in clinical and counseling psychology. And what that means is that we kind of combine the beauty of both worlds, the clinical and the counseling aspect of psychology, and kind of put it together so you will really learn from the best in learn from the best in the field. So for those of you who are not 100% sure what the difference is between clinical versus counseling, so clinical psychology traditionally focus more on the treatment of psychopathology and focus more on severe mental illness. And certainly this will be an important aspect of our program, is learning about the theories of counseling and theories of psychopathology and the different aspects of treatment for severe psychopathology. But there's also the counseling component, and counseling psychology traditionally focus more on the population are more on the quote-unquote sort of the normal end of the spectrum. They're relatively well, but maybe people going through different life issues, marital issues, family issues, personal growth issues, and all sorts of those things, and needed someone to talk to. And this is also a big part also of counseling psychology is also learning about ways to kind of help people the career through their career, helping them with the vocational planning and career, and also the multicultural counseling aspect, working with the culturally diverse population. So, our program really combine the sort of the key elements of these two fields, and students in our program will learn about these two fields. So generally, our program prepares our students to engage in professional practice of counseling, psychological assessment, and also and some of them may be interested in mental health research. And really, we provide students with a solid grounding in the theories and the intervention aspects that you can be applied in a variety of fields that certainly include mental health settings, but also academic settings and research settings as well. So with that in mind, also I think one of the biggest assets of our program is that we have some fabulous faculty members, and certainly I'm not saying that because I'm one of them, but we do have faculty members that are well-published researchers and scholars and practitioners also in the field and actively engaging in various grant-related projects and research and clinical practice here in New Jersey and New York City as well. And most of us are licensed psychologists, and we have some clinical and research strength in the areas of health psychology, multicultural counseling, neuropsychology, cognitive behavioral therapy, which is CBT for anxiety disorders, community-based interventions, trauma and intimate partner violence, and also mind-body approaches to well-being. So these are just some of the general research strength and the clinical strength, the strength among our faculty members. And if you're interested in learning a little bit more about our faculty members, I have included a list here, so you can click on the link later on and look through the list of faculty, their publications, and see if there's anybody that you'd be interested in working with. And I don't want to say that at the master's level, students typically you're not required to conduct research projects, but certainly that is encouraged, especially for those of you who are thinking about probably going on to apply for doctoral programs. It's always a good idea to gain some research experience and work closely with a faculty member. And also it's a good way to kind of get some in-depth understanding of a certain specialized area within the field of clinical counseling psychology. So these are just some of the specialty areas that we have in our program that our students are encouraged to get involved in. But a research thesis, a research master's thesis is not required for the master's program. Okay. And a little bit more about our program structure. Our master's program is designed to be completed in 2 years. So what that means is that if you're taking classes full-time on a full-time basis, and what that means is 12 credits per semester, you will be able to complete this degree in 2 years. And certainly we understand that some students may not be able to take 12 credits, that's 4 classes a semester, due to other obligations. So you can also complete our degree on a part-time basis, and that means then you may complete our degree in 3 to 5 years. The total required credits to complete the degree, that is 48 credits. So you need to complete the 48 credits to obtain your master's degree. With that said, students who are interested in getting a master's level licensure. So what that means is that in the state of New Jersey, there's a licensure, state licensure is LPC, the Licensed Professional Counselor. And for example, in New York, it's Licensed Mental Health Counselor. So these types of licensure, they require students to graduate from a counseling program with 60 degrees. I'm sorry, 60 credits. So what that means is that so students who are interested in pursuing those types of licensure later on should complete the additional 12 credits during summer month. And I can explain that a little bit more, but there's definitely that option to complete the additional 12 credits during the summer month and still complete your degree within the 2-year span. We also have a graduation requirement of 600 hours of supervised field work experience, or some call it practicum. So 600 hours practicum experience is basically doing clinical work in a setting that's arranged individually. And if some of students are curious about what that means, we can certainly save some time at the end and explain a little bit more what that is. And because this is a clinical and counseling psychology degree, so certainly clinical experience is going to be a big part of this program. So we do require our students to get that hands-on experience working with different types of population that they're interested in, and that generally the practicum courses that take place during their second year of their study. Okay. A little bit about our courses. So as you can see kind of here, that these are some our core required courses. So this break down into the foundation courses and advanced courses. We have our first year courses starting out giving you some of the basics of research methods, psychopathology, counseling skills, and ethics and professional orientation, and theories of psychotherapy and personality. And then when we advance to the second year, you'll be taking some more advanced classes on group interventions, more advanced psychological assessment, developmental psychopathology, brief and time-effective interventions, etc., and also the clinical practicum courses. So the idea is that you learn the foundation and some of the foundation skills, and then during your second year you will go out there engaging your practicum experience, and also come back to the class and kind of share that experience, and also learn some more advanced skills to prepare yourself to become a clinician, a mental health clinician, and possibly also a researcher for your career later on. So this leads to the next question: is this the right program for me? And I think to answer this question, certainly you'll have to kind of think about what would you like to do, sort of the question of what do I want to do when I grow up. And really the question here is that this certainly is a program that's more appropriate for those of you who are interested in some type of clinical work. And that clinical work, it could be in a community mental health agency, a community clinic, or hospitals, any type of for-profit or not-for-profit industry, and certainly academic settings as well, and engage in the psychological counseling and provide psychotherapy or psychological assessment. So these are some of the different types of clinical work that you may engage in, and certainly I think our program will prepare our students well for that. And if you completed the required coursework plus the additional 12 credits, and you will be eligible to sit for the licensure exam and also apply for the state-issued license, which is in the state of New Jersey. It's called an LPC, Licensed Professional Counselor. And some of our graduates go on into more of a research career. So we definitely have students go on and working in some type of research settings, and typically still more along the lines of mental health research. For example, perhaps working with cancer survivor patients. So, we have students working in research settings and working with teens, kind of dealing with issues with teen pregnancy, for example. Again, so those are some of the examples so students can go on applying the skills they learn from our program into a more research setting. And certainly every year we have at least a few students that are interested in going on to doctoral programs in the clinical psychology, counseling psychology, or school psychology. And certainly we also in the past have students interested in other types of program within the realm of higher education. And that's certainly, I think, our program will prepare our students well for that. And a little bit more about our program flexibility. And what we try to do is that we understand our students have busy lives, and many of our students have part-time jobs and other responsibilities. So what we try to do is offer classes on consecutive time slots on 2 to 3 days per week. Per week. So what that means is that, for example, during your first year, you may have classes only on Tuesday and Thursdays, and maybe during your second year, you may only have classes on a Monday and a Wednesday, just so that you don't have to come to campus so many days. You only need to come in 2 days, 2 days a week. Our classes are held mostly in the daytime during the first year. So the example would be like Tuesday 9:30 to 12, and then another class starting at 2 to 4:30, and then you have a little break in between to eat lunch and do group work, work on group projects with peers, and also sometimes we have some kind of talks and seminars, that type of thing, and that is held usually during the lunchtime. And our second year students typically have classes in the afternoon and early evening, and that will be from 2 to 4:30 and also from 5 to 7:30. And the reason is because during your second year, because of the practicum obligations, so many of our students will have to engage in practicum about 15 to 16 hours per week at the site. So we try to start classes a little later to accommodate for that, and also for those who has a part-time job somewhere else. So with that said, this is not a program that's not appropriate for students with a full-time employment during the day. Unfortunately, if you have a 9 to 5 job and you just can't take any time off during the day at all, or any of the days to come to classes during the day, then this may not be an appropriate program for you, or perhaps you will have to look for another job that can accommodate your hours. And that's really just the way it is. And in many ways, our students are most of our students are able to figure something out with their current employer to work things out, or they're able to find other employment that is better suited for their class schedule. So the next question is the admissions requirement. So this is certainly, I think, what's on a lot of your minds. It's like, how do I get into your program? What we're asking for is a bachelor's degree, and bachelor's degree, that also means that either you already completed it, or already obtained your bachelor's degree, or you are a senior and currently in the process of getting your bachelor's degree. We ask for the minimum GPA of 3.0, and the common question is that if I have a GPA below 3.0, can I still apply? And my question is that, I mean, we do get a number of very competitive applicants, so so we really want to stick with the 3.0 minimum GPA. And that certainly also is because just the demands of a graduate program. We want you to do well, want you to succeed. So we need to see evidence that you're able to do well in your undergraduate career. So that one of the evidence is that getting good grades as an undergrad, and that's at least a 3.0 GPA. In terms of GRE, and yes, we require students to take the GRE exam, the graduate records exam, and we don't necessarily have a minimum cutoff score that you need to obtain, but we look for competitive scores. So you certainly have to still prepare and do well on the GRE. And in addition, we ask our students to address the following questions in their personal statement. The questions are, what has led you to pursue a career in clinical and counseling psychology? And what do you see as your strengths and weaknesses? And how will they impact your ability to attain your academic and professional goals? And why does this program represent a good fit for you? So certainly we want you to talk about these aspects and anything in addition that you think will be helpful for the graduate admission committee to know, so that we'll review all this. And in addition to the items mentioned earlier, we asked the applicants to submit a curriculum vitae, and that's basically a more extensive resume. So if you don't exactly know what a curriculum vitae is, you can certainly Google it, or at least submit a resume. Certainly it will be fine. We asked for 3 professional recommendations, and that means recommendation letters from professor. Academic reference is certainly good, and we oftentimes encourage. But if you have any type of relevant experience, either relevant clinical experience, relevant human service experience, volunteer experience, people who know you well, but not necessarily a family friend, or anything like that, but someone who knows your professional capability well enough, then certainly letters from these people will be very helpful, and we do actually look through each of the letters and look at their comments on your abilities and strength and all that. So in addition to all that, we require our students to come in with these undergraduate coursework. You do not have to be a psychology major to apply to our program. You don't need to be undergrad psych major, but these are the basic courses that we look for. So general psychology, so basically intro psych, abnormal psychology, statistics or research methods or experimental design course. So that could be within the field of psychology or in other disciplines. So many disciplines offer these type of stats or research methods course, and we will accept all that. And also a class in developmental psychology or human development or child development is fine. So with all these are the materials that we need, and once your application is completed, so basically means all these things are in, your transcripts, your GRE, your letters, and the application, your fees are paid, then your application will be processed, and our faculty member will read through everything and also determine who we would like to invite for an interview. So interview those who are, so interviewer is required for the applicants, and that could be certainly done on site, and generally we prefer to have the interview done on site if that's possible. But if you're coming from far away and that's not possible, we also can arrange for a Skype interview. Okay, and also we are implementing a process of doing the criminal background check prior to the mission, so that students also wanted to make sure that that part is clear before you start the program. Our application deadline is March 1st. That's sort of the absolute deadline that all materials should be received by this date. So, sorry, it's May 1st is our absolute deadline. And that means everything should be in. It's not that you can submit the things starting on May 1st. It's everything should be in by May 1st. With that said, our school actually has a graduate assistantship that's available for our students. So those of you who are interested in applying for a graduate assistantship, which I'll explain a little bit in the next slide, are encouraged to apply sometime in March, so that especially that way it gives us some heads up in terms of we can see that you're interested in applying, and we can read your application earlier and also possibly make a determination earlier whether you will be able to receive the grad assistantship. And all the copies of all the materials should go to the graduate admissions office directly, and we only accept students in the fall only, so we only do enrollment once a year in the fall. Okay. So here's a quick link of the tuition, and you can go online to kind of check out sort of the tuition process. And just very quickly about a graduate assistantship. So there is a graduate assistantship available for students who are interested, and what that comes with is a $6,000 stipend and a waiver of tuition and fees for the extent of the appointment. And generally students that are enrolled in our master's program are here for 2 years full-time. So then if you're awarded a graduate assistantship, you basically are able to keep your graduate assistantship for 2 years, unless certainly your GPA fall below 3.0, you fall below full-time status and all that. And the grad assistantship selection process is determined by the graduate admissions committee within our program. So we'll have a little bit more details on how to get that. But again, those of you who are interested in grad assistantship, you should apply to our program sometime, complete all the process sometime in March, so we can make that determination. Okay. So just very quickly, and these are just some of the pictures of our facilities, and we have dedicated space for the graduate program. So within the psychology department, we have a graduate program in master's program in clinical counseling psychology, and also a PsyD program in clinical psychology. So we use the shared space. We have a dedicated seminar room, we dedicated a clinical teaching suite, and also a graduate study room where students meet and gather and use as a space to kind of just to hang informally and hang out. And so those shared spaces are available for our students. Here are just some quick feedback from our alumni. The graduates, for example, these are some of the feedback from class of 2014. I'll just read off one. William Paterson University prepared me to be the best clinician I could possibly be. Throughout my internship experience in the hospital-based setting, I was more qualified and experienced in handling difficult situations than any other interns from different schools. So again, just an example of that we do our best to kind of prepare students for different types of challenging environments, and a lot of our students actually end up thriving, and many of them actually are getting good positions in the community. So if you have any questions or inquiries, certainly we have a little bit of time right now to answer some of your questions. Here are some of our contact information. I'm Dr. Winnie Ma, my email's right here. And also we have a admissions coordinator, Dr. Uzma Ali. Her email's right here too, and she's also very responsive and can also address some of your questions too. So right now I'm going to turn it over to Brian to see if there's any other questions that come up that maybe we can talk about.
Thank you, Dr. Ma. And as we go through, just wanted to remind anybody, especially if anybody joined us a little bit late, if you do have any questions that weren't answered by the presentation or you want us to elaborate on a little bit further, you can type that question in the chat box. Now, I know we had at least a couple questions that have come through already. And then two quick housekeeping items for, again, anybody that may have joined us late. I just want to make sure you're aware, if you are interested in what you heard today about the Clinical and Counseling Master's Program, we have an open house coming up on February 26th. So do keep that in mind to save the date. You will be receiving an email invitation for that event if you haven't already, so want to make sure that you know that we are going to be having that from 1 to 3. That's a Sunday, so just keep that in mind. And lastly, we are going to be making this presentation available in its entirety, the recording from it, on our YouTube channel within about a week, and you will be receiving an email. So again, if you joined us a little bit late and you missed any of the slides, I just wanted to make sure you are going to be able to catch up on that. So Dr. Ma, I'll jump right into one of the first questions that came through. One prospective student wanted to know, could you elaborate a bit more on what practicum courses involve? Are these courses in a clinical setting with hands-on learning, or is it more of a classroom setting?
Mm-hmm. Okay, thank you. So practicum, that's also a very common question. So practicum, there's sort of two components to the practicum experience. One is definitely the hands-on experience that generally students go on the practicum during their second year of their study. And that could be and in terms of what the typical question that comes out is what type of settings do students go to do their practicum. We generally don't necessarily assign our students to any sites. And I know some schools will do that. Like you go there, you go there. What we do is we try to meet with our students and kind of and talk to our students about their interests and kind of where they want to go professionally. And because our students do have a very wide range of interests. So for example, some of our students want to work with children and adolescents. Some want to work with substance abuse in the substance abuse kind of facilities. Some are more interested in psychological assessment or neuropsych assessment. Others are interested in inpatient working with severely mentally ill, and others wanted to work with sort of the college student population. So because of that, our graduate or our practicum coordinator, Dr. Torsney, generally meet with students individually, talk about your interests and the type of setting, the type of experience you want to get, and she will make some suggestions in terms of these are certain sites that in the past our students have gone to, or certain sites we have a relationship with. So you will have to certainly, it's like applying for a job. You have to apply to set up an appointment, apply for the practicum positions, and then go on an interview and see if you get accepted by those sites. And then certainly you can apply for multiple sites, go on different interviews, and then decide which setting you want to get your clinical experience. As I kind of briefly mentioned earlier, generally the practicum experience at these sites are typically students spend probably about 15 to 16 hours a week at their site, and depending on the needs of the site. And they will get on-site supervision from a licensed clinician that they will supervise their clinical work, and sometimes students will get involved in case conference, other types of training activity at their clinical site. So that is a big part of that component, and students are required to obtain at least 600 hours of practicum experience during the whole academic year. So basically from September to end of May, you should get 600 hours. That's a requirement for the program, also that later on some state licensure requirement as well. So the practicum courses, I know the question was asking about practicum courses. So the practicum classes actually is that we still have, so once a week in class, you'll meet and actually talk about your practicum experience. A lot of times students at different sites have different issues and concerns that come up at the practicum site. So this is a space to definitely talk about that, address that. And in addition, we will talk about case conceptualization. We will talk about applying different types of theories. We'll talk about, for example, how do you apply sort of some of the multicultural counseling concepts that we learn in class in working in the setting or in working with this population that you're working with. So there's a whole range of topics that we'll delve into that relating to your practicum experience during your practicum class. So in some ways, it serves as an additional support and additional supervision, because you can also call that sort of additional group supervision, and you can get feedback from the instructor and also your peers about your practicum and your clinical work. Okay, so that's kind of the, maybe perhaps a little long-winded way to answer that question. All right, Brian?
Thank you very much. And another prospective student has heard that in the field, a doctorate is a requirement in order to get a job or be successful, and there had a little bit of concern about that. Could you speak a little bit, I guess, from your own experience on pursuing employment, alumni and otherwise, with the MA versus the PsyD?
Absolutely, that's an excellent question. So whether you need a doctoral degree or not, and then I think that's really, it's up to debate. But I want to say from my experience is that because I am also a practicing clinician working in a community mental health setting, there are definitely actually in many community mental health settings, and certainly in hospitals and some university settings, they are hiring master's level clinicians. And in fact, in many places, master's level clinicians are preferred for various reasons. So definitely there's definitely certainly job opportunities for those with master's degree. So I don't think you will have to worry about that. And certainly I think that the more competition you may have is with those with the social work degree. So there are some settings that actually specify they want to hire those with social work, so licensed social worker. And I won't go into sort of difference between our degree versus social work. We may want to save that for later. But that's generally sort of in terms of talking about competitors. That's the types of competitors that you're competing with. But in terms of the doctoral degree in the field, so doctoral degree in the field generally there are settings that look for those with a doctoral degree, a licensed psychologist. Typically the VA and some college counseling centers, and certainly some of the hospital settings that they are looking for those that are licensed psychologists. So they're positioned specifically for that, and typically those are the ones that involving sort of more, perhaps more of the aspect of training, perhaps taking on more of a higher position in terms of supervisor and administrative position, and certainly more advanced kind of level of clinical work. Then they might ask for a psychologist degree. So that is that. So sometimes I would say that if you're not 100% sure that whether you should do a master's or a doctorate, I would probably start with a master's degree, because you're going to always get a master's degree, go out there, get some clinical experience, and see if you feel like you need to come back and get a doctoral degree. Also keep in mind that the doctoral degree, doctoral degree takes longer. There's also the research component, the dissertation, the research component that's involved if it's in the PhD program, and our own PsyD program also has a strong research component as well. So for those of you who are just absolutely not interested in research whatsoever, that may really not be the right type of degree for you. And many of our students can do great clinical work and even engage in private practice and all that with just a master's degree. Okay, so that will be it for my answer for this question.
And then one other question for a student who hasn't experienced the licensure process, especially if it's a current William Paterson student now. Could you talk a little bit on the post-grad level, what goes into licensure, just the process in general?
Absolutely. So in terms of the master's level licensure, so I'll talk a little bit about the New Jersey. So in the state of New Jersey, to apply for a PC, you need to graduate from a program with a 60 credits. which our program will be able to offer you. And also, you need to have certain types of coursework. And in the application process, they'll ask you to list out all these coursework you have taken and whether they fulfill certain categories. And again, our coursework will fulfill all the category that's required. And you will need to also take the licensing exam, which is the National Counselor, the National Counselor exam, which is a counselor, basically examination of some of the key contents that you've learned during graduate school. So after you submitted all those paperwork and qualified to sit for the exam, you take the exam, you pass. In New Jersey, you'll get the what we call the LAC, which is the Licensed Associate Counselor. Okay, so you get an LAC doesn't necessarily mean that you can kind of go out there and practice on your own. In New Jersey, they require you that after you get your LAC, you still need to obtain certain number of hours, supervised clinical hours. I believe will be 3,000 hours. If postmasters, it will be 3,000 at least. Wait, actually 40. Sorry, let me backtrack. Actually, for those with a master's degree, you need I believe 4,500 hours of supervised clinical hours, and then provide documentation and all that, and you actually have to get all that approved by the state licensing board. And then after you get all those clinical hours, then you can apply to obtain your LPC. Okay, so it is going to be a process. It's not just that once you get this degree, go take a test, then you automatically go out there and practice independently. The process of getting LPC may take a few years for many of our students, so just something for you to be aware of. And many clinical sites that are aware of this, and so suddenly when you go out there and apply for jobs, you should definitely talk to them about getting the supervision that you need, the supervised clinical hours that you need towards your licensure. Okay. In New York, it's slightly different, and it's actually in many ways a little less complicated. And certainly in many different states, they have very similar requirements. So I definitely would encourage those who are interested in the master's level licensure, and those of you who may or may not want to stay here in New Jersey, is to look up the state licensing board and look up the licensing requirements. And if you have any questions whether our program will prepare you for that licensure, certainly you can ask us. Just send us an email, talk to us, and then we can try to provide more information about that.
Thank you very much. Another question came through. I know you referenced competitive GRE scores, and the student wondered if you could elaborate a little bit more on the type of score that a prospective student should be striving for.
Okay, I know it's hard to say competitive, right? Because what does that competitive really mean? So in the past, I think in the past in some of our publications we say that we want students to have obtain at least 50th percentile for all three categories. So basically the GRE, verbal, quantitative, and analytical. So that those at least strive for at least 50th percentile. So in the past, that's kind of what we're advertising, but what we realize is that actually over time that there are a lot of our applicants don't necessarily obtain the 50th percentile, but they still have very good undergraduate GPA, have very strong letters, have good experience, very strong essays, and they came into our program and are still able to do very well in our program and go out there, have good jobs and all that stuff. So we really say competitive, meaning that we're not necessarily going to cut you off, basically not read your application because you have low GRE. But I think something striving for close to 50% will make you a very strong candidate. If not, certainly a little lower than that is fine. What we're hoping not to see is those who came in basically didn't prepare to take the GRE test, just take the test and then scored in the very bottom, very bottom, and that's always very questionable for us. Is sort of a red flag. Like, we understand some students are not good test takers, but you score way in the bottom, like the first percentile, the second percentile. That means you're way in the bottom. What does that really mean? Okay, and certainly if you don't have a strong GPA, undergraduate GPA and all that, then and also if you have very low GRE scores, and then certainly that will be a disadvantage for your application. So that's why I encourage students at least to spend some time, prepare for the test, and do the best you can, but not necessarily to worry too much about you have to sort of achieve a certain score in order to get into our program. I hope this helps.
Thank you very much. And it looks like that's it for the questions as of right now. For everyone in the Graduate Admissions Office, as well as our Clinical and Counseling Psychology program, I want to thank all of you for taking the time out of your schedule to join us for our webinar today. Certainly hope that this was helpful. Would make one last plug. If you are interested in the program, if you want the chance to meet Dr. Ma, her colleagues in person, I would stress considering attending our open house coming up on February 26th, if that works with your schedule. Other than that, as I mentioned, we are going to be sharing this recording with you in its entirety on our YouTube channel within about a week. So if you join us a little bit late, you can keep your eye out for that. If you have any further questions that pop up, I can't stress enough, Dr. Ma's contact information is right there. Feel free to shoot her an email, and certainly I'm sure if you wanted the opportunity to come on campus, set a meeting time with her, I'm sure she'd be happy to do so, or one of her colleagues. But again, thank you all so much. We hope you have a wonderful evening, and certainly we hope to see your application soon, and hope that you can join us on campus for our open house soon. So Dr. Ma, thank you so much, and everybody have a wonderful day.
Thank you.